Okay.
Okay, I have a new patient, Mr. P. Campbell, who is a 45-year-old uncircumcised male who is admitted to the hospital with difficulty voiding for the last week. The urologist has given admit orders. I'm going to go ahead and complete the admission and look at my orders. And the order is to place an indwelling retention catheter now on this patient. So I'm going to go ahead and gather my materials. And I have a 14 French Foley tray. And I'm also going to take in a couple of washcloths for cleaning the patient after the procedure. Hi, Mr. Campbell. My name's Melissa. I'm going to be your nurse today. Your doctor has ordered a couple of things. He's ordered a Foley catheter to be placed. Have you had one of those before? Okay, so you're a little bit familiar. Are you okay with us going ahead and doing that now? All right. Well, the first thing that we need to do is I need to see your armband and verify that you are who you say you are. Where's your armband? So can you tell me your name and date of birth? Just 1 second. Okay. Name and date of birth. We got that. Let me verify it with your orders too. All right. Can you tell me why you're here today? Perfect. Do you know where you're at? All right. Is it okay if I go ahead and press around on your bladder a little bit just to see where we're starting from? Okay, and I have one more question for you. Do you have any allergies to betadine or latex? No allergies? Do you have any other allergies that I should know about? Amoxicillin. I think we have amoxicillin listed. Is there anything else besides amoxicillin? All right. Well, I'm going to pull your covers down just a little bit. And I'm going to go ahead and just press around a little bit. You tell me if you're feeling any uncomfortableness. It's a little bit tender. All right, well, I think that we're okay to go ahead and get started, and some of that tenderness and fullness you should feel a little bit better with after we get this done. So I'm going to put a bath blanket over you, and we're going to pull your covers down to the foot of the bed. And then I'm going to need to lift the bottom of your bath blanket up and expose you just a little bit. All right, and it looks like the tech probably has already been in here and done some peri-care on you. So I think we're okay to go ahead and just start the procedure. If you can just hang tight with me for a second while I get all of my materials together. Let's see, we have a sterile catheter kit with a current expiration date. So we should be good there. Mr. Campbell, if you're ready, we'll go ahead and get started. I'm going to need to retract your foreskin here. And I'm going to clean everything off real well with some betadine. Okay. All right, are you ready? If you could just take a big deep breath for me. All right, we're almost finished. Just 1 second, and I'll secure the bag of the catheter. That's where the fluid's going to go. Okay, I'm going to go ahead and secure this to your leg. And then I'm going to put the bag down here on a non-movable portion of your bed. And then we can get you cleaned up a little bit. All right, does that feel okay? You should already, let's go ahead and pull the foreskin forward. And you should be feeling a little bit of pressure relief already because you're already draining here. And I'm going to go ahead and cover you back up. All right, is there anything else that you need, or do you have any questions? All right, well, I'm going to go ahead and put your bed down and make sure you have your call light within reach. And do you need extra pillows or anything like that? You're good? All right, let me step out for just a minute and document everything that we've done. Was that too painful for you? No, you seem to tolerate it pretty well. All right, thank you, Mr. Campbell. I'll be back to check on you shortly.